Imagine fleeing your home because of war or persecution, and you reach safety in another country. You'd think the worst is over, right? Well, for lots of refugees, that's when a whole new load of challenges comes up. And these challenges can have a big impact on their mental health. So today we're going to take a deep dive into the mental health of refugees in high-income countries. And to help us, we've got some fascinating research from the British Journal of Psychiatry. Get ready for some pretty surprising stuff.
Yeah, it's a topic that doesn't get enough attention, but the findings are really pretty startling.
So this meta-analysis we're looking at, it paints a pretty stark picture. It seems like refugees experience much higher rates of anxiety, depression, and PTSD. And we're not just talking compared to the global average. We're talking higher than people who are still living in conflict zones.
Yeah, that's right. You'd think that reaching safety would mean things would get better, but that's not always how it works. The data actually shows that the rates of these mental health challenges, they don't go down that much, even after years of living in a new stable country.
Wow, that's pretty surprising. It really makes you think about that idea that time heals all wounds. So what could be causing this?
Well, before we get into the why, let's just make sure we're all on the same page about how these conditions are even measured. The research used both clinical interviews and self-report tools, and that can actually affect the numbers.
Right, because a clinical interview with a mental health professional is going to be a lot different from someone just filling out a questionnaire about their symptoms.
Exactly. Self-report tools are great for screening a large number of people, but you might end up seeing higher rates because some of the symptoms overlap. For example, someone who's dealing with anxiety might also show some signs of PTSD, and a self-report tool might not be as accurate when it comes to telling the difference between the two.
So how do we understand those higher rates of mental health issues then? It's clearly not just about leaving a dangerous situation. What does the research say about the factors that are involved here?
Well, it's complicated, but the study really focuses on two main periods, pre-migration and post-migration.
Okay, so pre-migration, I'm guessing that's all about the experiences that forced someone to flee in the first place.
Precisely. We're talking exposure to war, torture, persecution. Those kinds of experiences, they have a deep impact on someone's mind. And that trauma, it doesn't just disappear when you cross a border, but then on top of that, you have the post-migration challenges.
Like what kinds of things?
Well, just think about the journey itself. It can be incredibly dangerous and traumatic. Then there's the long asylum process, the stress of trying to figure out a new culture and language, often with very few resources. And many refugees are dealing with family separation, they face discrimination, they struggle to find work. It's a lot to handle.
Yeah, it sounds incredibly overwhelming. And that finding about how time doesn't necessarily lead to improvement, well, it just shows how complex this whole issue is.
Yeah, it really does. It challenges that assumption that just being in a safer place will automatically heal those psychological wounds. It's not enough just to be in a safe environment. There needs to be real focused support.
So knowing all of this, where do we go from here? What are the implications of all this for research and for actually helping refugees?
Well, that's where things get really interesting. This research is like a foundation. It helps us to understand how big this problem really is. But now we need to start digging deeper into things like preventative measures and treatment options that are specifically designed for refugees.
So it's about moving beyond just identifying the problem and actually finding solutions that work.
Exactly. This meta-analysis is basically a call to action for researchers, policymakers, and really anyone who wants to make a real difference in the lives of refugees.
Okay, so we've established that refugees carry a heavy mental health burden with them, and it doesn't just go away over time. So let's talk about what can be done. What are some of the most promising ways to really address these mental health needs that refugees have?
Well, one thing that's getting a lot of attention is this idea of culturally sensitive therapy. It basically recognizes that traditional therapy models, while helpful for many, they might not always work for refugees because of their unique experiences and their cultural backgrounds.
So you're saying it's not a one-size-fits-all approach. It seems like assuming that everyone's the same, well, you could miss some really important cultural nuances.
Right, exactly. Culturally sensitive therapy involves therapists who are trained to understand and respect the cultural values and beliefs of their clients, even things like their traditional healing practices.
That makes a lot of sense.
Yeah.
It's about creating a space where someone feels like they're really seen and heard,
Yeah.
and not judged by the standards of a different culture.
Exactly. Building that trust and rapport is essential for any kind of therapy to be effective.
So what would this look like in practice? Are there specific examples of how this culturally sensitive approach actually plays out?
Oh, absolutely. There are many ways that therapists adapt their approach. For instance, they might incorporate traditional healing practices from the refugees' culture into the treatment plan.
Wow, that's fascinating. So instead of dismissing those practices as irrelevant, they're actually seen as part of the healing process.
Right. It can be incredibly empowering for someone to have their cultural identity validated in that way. And it acknowledges that healing can take many different forms. Another really important aspect is language, making sure that therapy is conducted in the refugee's native language. That can remove a huge barrier.
Yeah, I can imagine. Trying to process all of those complex emotions and trauma in a language that you're not fluent in, that would be incredibly difficult.
Yeah, it would be like trying to explain your deepest fears and anxieties in a language you're still learning. Providing interpreters or therapists who speak the client's language is so important.
It's about making that space as safe and comfortable as possible. Beyond individual therapy, though, it seems like community plays a big role too, especially for people who've been uprooted and might be feeling isolated.
Oh, absolutely. Community-based support networks are so important. They can provide that sense of belonging. They connect refugees with others who have had similar experiences. And they can offer practical help with all the challenges of resettling.
So how do you actually build and strengthen these networks?
There are some great models out there. Community centers specifically for refugees can be amazing resources. They offer a space to connect with others, share experiences, and just feel less alone.
It's that feeling of shared understanding that can be so powerful when you're dealing with so many new and unfamiliar things.
Right. And these centers often offer practical support as well. Things like language classes, job training, legal aid, things that can help refugees rebuild their lives and start to feel more independent.
It's taking a holistic approach, addressing both the psychological and the practical needs. But we can't talk about solutions without acknowledging some of the bigger issues that play a part in all of this. Things like discrimination and prejudice. They create such a hostile environment for people.
You're absolutely right. It's like adding insult to injury. Discrimination and social exclusion can make it that much harder for someone to heal and build a new life.
So what can be done about these deeper societal problems? They seem so ingrained. It's hard to know where to even begin.
It's going to take a multi-pronged approach. We need to advocate for policies that protect refugees and promote inclusivity. We need education and awareness campaigns that challenge those prejudices and help people build empathy. And we need to create opportunities for meaningful interactions between refugees and the wider community.
It's about getting rid of those us versus them mentalities and recognizing that we're all human.
Exactly. It's about creating a society where refugees feel welcomed and valued and supported, instead of being ostracized and marginalized.
That kind of shift in attitude could have a huge impact on mental well-being.
Okay, so we've got culturally sensitive therapy, community support, and tackling those bigger systemic issues. Is there anything else that stands out as a really effective intervention?
Yeah, one more thing that I think is really important is early intervention. So you're talking about being proactive instead of waiting for a problem to become a crisis.
Exactly. What if we could identify refugees who might be at risk for mental health challenges very early on, like soon after they arrive? And what if we could offer support before things get really bad?
Yeah, seems like that could prevent a lot of suffering down the road.
Exactly. This could involve things like screenings for mental health concerns, mental health education, coping skills training, even just creating a safe space where refugees can talk about their experiences and their emotions openly.
And I imagine early intervention is especially important for children and teenagers. They're so vulnerable to the long-term effects of trauma.
Absolutely. If we can give them the support they need early on, we can help them build resilience and really minimize the impact of those traumatic experiences.
It's about giving them the foundation for a healthier future. This has been a really insightful conversation. We've talked about some really promising solutions, but I'm sure there's a lot more to unpack when it comes to actually making these things happen in the real world.
You're right. Implementing these solutions on a larger scale, well, that comes with its own set of challenges. And that's a conversation for our next segment.
We've talked about some really promising ways to help refugees who are struggling with their mental health. But I imagine that actually putting those solutions into practice on a large scale, well, that's probably not always easy. What are some of the obstacles that we need to think about?
Yeah, so one of the biggest challenges is accessibility. I mean, it's great to have all these wonderful programs and services, but if refugees can't actually get to them, they're not going to do much good, right?
So it's not just about having resources, it's about making sure that they're available to the people who need them.
Exactly. And there are all sorts of barriers that can get in the way. Some of them are logistical.
Like transportation, location, scheduling, that kind of thing.
Exactly. Imagine you're a refugee. You're working multiple jobs, you're trying to learn a new language, you're trying to navigate a new city, and then you have to find the time and money to travel across town for a therapy appointment during the workday. It's almost impossible.
Yeah, it seems like we're setting them up for failure before they even begin.
Right, so we need to be more creative and flexible about how we deliver these services. Maybe that means offering evening or weekend appointments, or helping with transportation, or even taking those mental health services directly into the refugee communities.
What about using technology? It seems like telehealth could be a real game changer for people who are in remote areas or who have trouble getting around.
Oh, absolutely. Virtual therapy sessions can really break down those geographical barriers and make it much easier for people to connect with a therapist. But we also have to think about cultural and linguistic accessibility. As we talked about before, culturally sensitive therapy is so important. And that means making sure that language isn't a barrier.
Right. It's not enough to just have someone who can translate words. You need someone who really gets it, who understands all the little things about the client's culture, their beliefs, their values.
Exactly. That kind of understanding creates a much stronger connection and makes therapy much more effective. So accessibility is crucial, but we also can't forget about affordability. Mental health care can be really expensive, and a lot of refugees are starting over with very limited resources.
So how do we make sure that the cost of treatment isn't stopping them from getting the help they need?
Well, there are a few things we can do. We can partner with community organizations to make the most of the resources we have. We can try to get grant funding specifically for refugee mental health services. And we really need to push for policies that expand mental health coverage for refugees. We have to make sure that mental health care is seen as a necessity, not a luxury.
It's about putting their well-being first right from the start. And it seems like all of this is going to require a workforce that's actually equipped to work with this population.
You're absolutely right. We need trained mental health professionals who understand the unique struggles that refugees face. And that means specialized training. Training in things like culturally sensitive approaches, trauma-informed care, and working with interpreters.
So we need to give these professionals the tools they need to do their jobs well. And we can't forget about the professionals themselves. Working with trauma survivors can take a real toll.
Yeah, burnout is a huge concern. We have to make sure that those mental health professionals have access to ongoing support and supervision so that they can provide good quality care over the long term.
It's like that saying about putting on your own oxygen mask first. You have to take care of yourself before you can take care of others. Now, if we're going to make all of this happen, it seems like it's going to take a lot of collaboration.
Absolutely. We need to bring everyone to the table. Government agencies, nonprofit organizations, healthcare providers, and of course the refugee communities themselves.
So pooling resources, sharing expertise, and really coordinating our efforts.
Exactly. Breaking down those walls between different groups and working together towards the same goal. But there's one more piece to this puzzle that's absolutely essential: research.
So we're not just throwing solutions at the problem. We're actually checking to see what's working and what's not.
Precisely. We need to put money into research that looks at how effective different interventions are. Research that helps us figure out the best practices and informs policy decisions.
It's about using data and evidence to guide our actions so that we can have the biggest impact possible.
Exactly. Research helps us to keep getting better at what we do and to keep improving the lives of refugees.
This deep dive has been really eye-opening. We've learned about some pretty hard truths about the mental health challenges that refugees face. But I'm also leaving this conversation feeling hopeful. We have the knowledge and the resources to really make a difference.
I agree. It's a complicated issue, but it's not impossible to solve. By working to remove those barriers to access, making sure that treatment is affordable, and investing in a well-trained workforce, we can create a system of support that truly meets the needs of refugees.
And by making research a priority, we can make sure that our efforts are always moving forward.
It's a team effort. It requires empathy, compassion, and a commitment to action from all of us.
Well, thank you for joining us on this deep dive. We hope you've learned something new today, and we hope you'll keep exploring this important topic. Until next time.